Hello and welcome. I'm Dr. Jessica Everett, the Global Medical Director of Child Family Health International. Thanks for joining us today as we talk about how universities and colleges and departments within institutions can collaborate and partner with Child Family Health International. I'm joined today by our CFHI team, and I'll just pause, not the whole team, but those of you that are with us, could you introduce yourselves?
I can start. Hi, everybody. I'm Carolina Bolaños. I'm Director of Programs for CFHI.
Hi, everyone. I'm Bethany Peterson. I'm the Assistant Director of Health and Safety, so I'll be talking to you later with a quick overview of our health and safety infrastructure.
Hi everyone, my name is Blair Murphy. I'm the Communications and Outreach Coordinator with CFHI.
Thank you. And we are representing a much wider team, and I'll speak to kind of the infrastructure and organizational structure that we have. But just a little background on who CFHI is. Many of you have heard of us. We are a nonprofit organization that was started by Dr. Evelyn Jones almost 35 years ago. And she did so as a Stanford medical student because she was looking for an international elective and could not find one that was really value aligned with her perspective of the dynamics of students going abroad from high income countries to low and middle income countries. So she started CFHI after doing a rotation with Dr. Edgar Rodas, who was a surgeon doing a mobile surgical unit in the Amazonian forest of Ecuador. We grew from there. We now have a global team that spans 10 countries. We have almost 20,000 alumni and almost or over 100 academic partners. And we are going to talk today about how you can join this CFHI family and movement. CFHI is recognized by a lot of awards. We have special consultative status with the United Nations. We also are recognized for our transparency as a nonprofit, as well as our rigor as an international education organization. CFHI and a lot of you that are doing this work really are at the nexus of different contexts, the context of some sort of academic or extracurricular structure, such as a volunteering experience, service learning, internship, shadowing, capstone, etc. And that is merged with some sort of global health or public health context and a local community that experiences some degree of resource constraint. There's a variety of terminology that low and middle income countries have gone by in the past, but the commonality for many global health experiential learning opportunities is that they are taking place in a setting that has health disparities. And the entire mission of global health as an endeavor is to understand and address health disparities, both those happening in our own backyard domestically as well as around the world. In order to talk about who CFHI is and how and why we do things the way we do, we have to talk about the antithesis of CFHI experiences. And unfortunately, there is a long legacy of poorly designed global health and international education experiences for students under the auspices of health and public health. This is an example of one of those. This is an Instagram post by a student who said, suturing up a head laceration on one of the Vietnamese locals, hashtag volunteer surgeon, hashtag I don't know what I'm doing. And obviously, this is not a CFHI participant, but there are many predatory organizations that both partner with schools and work outside of the confines of academia, such as student-run organizations or other types of nonprofits or for-profit entities. And unfortunately, there's been a confusion that international experiences in health-related fields are an opportunity for students to go abroad to directly deliver care, often care that they do not have expertise in, are not licensed to practice. And this has led to harms for patients, as well as reinforced colonial, racist, and systemic injustices. And so we exist in part as an antithesis to this and really to recognize that there are outdated ways of students going abroad for health-related experiences, and there are contemporary ways of doing this. And so we are constantly evolving to stay on the forefront of these trends and realities. Some of the ways in which we do that is have a very intentional structure, both for the organization as well as the learner experience, and by extension for our university partners. So I'm going to talk through some of these foundations, but they include values and principles that are then translated into operational frameworks and processes, then experienced by a learner in a participatory way, pre-departure, even through the outreach and marketing efforts. And then during their immersion, whether that's place-based, in person or virtual, and in an ongoing iterative way through reflection and lifelong learning. Child Family Health International's teams span 10 countries, and the commonality of all of our programs is they provide the 30,000-foot view of global health, but then they drill down in an asset-based way into ways in which countries around the world are having amazing successes providing healthcare and public health and affecting health outcomes. And so you can see some of the different themes that are related to the program sites. There are also opportunities outside these themes, but I want to point out kind of the breadth from public health focus in Delhi, India, to health systems building and how the Philippines services their nation over an archipelago of over 2,000 islands, to the initiatives in Quito, Ecuador that are integrating indigenous birth techniques alongside biomedicine to reduce the burden of disease for maternal and infants. And then there's health systems approaches, such as those that have happened in Mexico over the last 2 decades, that are providing universal healthcare coverage and kind of the evolving ways in which countries are implementing health as a human right. So the four of us are the faces today, but we are standing on the shoulders of really the power generation of CFHI, which are our local community-based teams around the world. Here are some of our team members, and we want to recognize that we have the privilege of being here, but the work is actually being done in local communities around the world. CFHI has a very intentional leadership structure of our programs. So we have local coordinators at every site, as well as medical directors, and then country coordinators in some of our geographies. So these are the folks that make CFHI happen, and we get to be here to tell you their story. We also have invited faculty, so these are the invited faculty for our virtual global health elective, and want to recognize that those faculty are coming from 12 countries and providing an array of curricular elements to make our virtual programs come to life. In terms of our volume of scholars, you can see kind of the trends here. This graphic has broken it down between our virtual and our place-based or in-person programs. You can see obviously where the pandemic was happening in 2022. We were coming out of the acute episodes of the pandemic, and a majority of our scholars were doing virtual programs at that time. We've now seen that flip. More students are going abroad in person, but there still is a significant portion of learners who are engaging in virtual global health experiential education. And we are very committed to our virtual portfolio. It is partly how we are able to offer programmatics to students that don't have the means or the realities, logistics to travel. And so we really try to have that equity be in part based on our virtual offerings. In addition, just to recognize that CFHI works with institutions and learners from undergraduate, graduate, and postgraduate levels. And you can see in 2025, we had learners from 23 countries. We do see, as many do in global health degree programs, predominance of female participants. We have a growing number of master's programs who are partnering for their practicums that we have now formalized over the last 7 years. There's a lot of different formats of our programs, and Carolina is going to speak later to some of the custom programming and the building blocks of that. But I just want to recognize that CFHI is able to partner with institutions in a very flexible way. So some of the institutions we partner with are doing faculty-led programs, other are individual student enrollments, some are student groups, some are for credit, some are not for credit. The students are going under different kind of programmatic structures, such as internship or service learning or volunteering or study abroad or electives or practicums or capstones. So CFHI is able to utilize the frameworks we have in place to serve a variety of institutions and learners. As we go a little deeper into some of these operational frameworks and values and principles, I want to kind of give insight into some of the models we use. This is a graphic out of graduate medical education in Canada, and it has the different roles we're trying to prepare our learners for and the different curricular structures that exist. But what's really important here are the values and principles that are in that red and purple outside rung. So some of those values and principles are things like social justice and health equity. These often feel like pie in the sky aspirations for our learners and trainees. But I think there's also values and principles that we help trainees live as they do their international experiences. And that includes solidarity, reciprocity, responsiveness and accountability, honesty and openness, humility, sustainability, and respect. And so we bring these values and principles to life in a multifaceted way so that there is authenticity and congruency between the aspirations of global health and the experiences themselves. Some of the operational frameworks that are important for CFHI include featuring evidence-based interventions, which mostly focus on longitudinal sustainable health systems, looking at implementation science. We do not encourage or allow students to set up temporary activities that are based on the student's presence. So we are really integrating them in an anthropological way into complex realities and systems. We partner very closely with the collaborative on fair trade learning, ensuring that there is reciprocity for all the hosts of students, and there's co-creation, co-design, and accountability for how programs are made, how they operationalize, how the impacts are evaluated, etc. We have a big focus on decolonization, and I'm going to speak to some of the shifts that we encourage in learners. And similarly, as we partner with institutions, we're going to do difficult reflecting on the role of the university and colleges within the university and even faculty in ensuring that we are challenging colonial assumptions, mindsets, and neocolonial activities. There's kind of a rise. I just got back from CUGH, and there's a rise in discussing sovereignty in global health. And I think there's a lot of opportunity for connecting the dots between sovereign global health approaches that are really emphasizing local leadership, giving countries their own abilities to determine their futures and do it in a way that culturally and socioeconomically works for them, and challenging some of the hegemonic assumptions, along with merging that sovereignty approach with decolonization and some behavior change for outsiders that are engaging in other countries. We utilize asset-based community development and engagement, which was formalized in the 1990s at Northwestern University, and really requires that outsiders look at the strengths, capabilities, and capacities in places that appear to be poor or lacking because of the frame of reference that outsiders are coming from. So we really try to flip that script. We're not looking at what's not going well. We're not looking at poverty. We are looking at resourcefulness. We are looking at cost effectiveness. We are looking at resiliency, persistence. We are looking at health as a human right as it takes shape around the world. And then cultural humility and utilizing cross-cultural frameworks that decenter the culture of the visitor and recenter the local culture and practices. So I mentioned that these decolonized shifts are what we base some of our pre-departure training on, what we really encourage of the trainees that go abroad with CFHI. And so I give these to you both as food for thought and also because this is what your students will be hearing from us in terms of really encouraging them to move from a mindset of certainty and exceptionalism and superiority to one of curiosity, humility, even a sense of inferiority to the capabilities of local community members and local professionals. We talk a lot about how our brains will try to oversimplify things we don't understand. So psychologists call this the oversimplification cause fallacy. While that's a complicated word, basically it means if we put learners into new settings that look very different and act very different than they're used to, they will try to oversimplify cause and effect. And so we point that out and we work against that and really embrace complexity and embrace ambiguity and look at things over a long arc of history. Similarly, we encourage them to move from a sense of being rushed and having to accomplish something to being unhurried and prioritizing sustainability over accomplishment. And so we are going to have conversations, if you're interested in partnering with CFHI, on how we make sure the academic components are not encouraging the trainees to be rushed, to be accomplishment oriented, because that does detract from their ability to actually learn about a global health reality. And so when we ask students to have these shifts in their mental mentality and their psychological approach, there's always the question, well, if I'm going to be humble, if I'm not going to be the agent, if I'm not going to be accomplishing something, then how am I being helpful? There is still a pervasive desire to help and to help in an immediate way. And so we point out some of the research that CFHI has done in how students are beneficial no matter what they're doing in a technical way. And this includes that they're improving the English proficiency of everyone they come in contact with, which is linked to job opportunities, to socioeconomic mobility. We emphasize how they are bringing prestige to all the institutions that are hosting them. And that is seen as a positive because these institutions then build their reputation with local community members. We emphasize how they are helping local practitioners and community members increase their own sense of global citizenship. We emphasize how they're helping local institutions build networks and helping local professionals build their leadership skills by being able to oversee and lead the programs and work with collaborators across 10 countries. And then, of course, there is the movement of and access to resources, which include the financial resources of the tuition that is linked to the students, as well as students' purchasing power locally, as well as other intellectual resources that the students often bring. This quote captures that benefit that our learners are having so that they don't have to play doctor. They don't have to pretend they already are experts. Let's let them be learners. And as doing such, as they evolve, they are helping local community members feel more self-actualized. And this is a quote from one of our medical directors in India who said, as a global citizen of the world, if I'm able to educate a student from any other nation and he or she feels a little softer about places that are not as economically well off, then from that perspective, of course, it is beneficial because we are benefiting students living an affluent life to have a more balanced view of life. And so as we, of course, want to have rigorous competencies and learning objectives, we also want to recognize the shifts and really the humanizing and the globalization that happens alongside that. In terms of where we get our competencies that we target, this includes data from employers that are really asking that graduates have a well-founded understanding of global health realities and complex realities, that they be flexible, adaptable, and creative, that they have cultural sensitivity and cross-cultural skills, And then we also base our competencies on peer-reviewed competency sets, such as those that come out of CHGH. And these are the examples of the third edition of the competency toolkit and the domains of competencies. And so we tie our programs to these competencies. And then when you partner with CFHI, if you have specific competencies you want them to work on, we will integrate that into the curricular frameworks. In terms of how we nurture cross-culturalism, we partner with two cross-cultural effectiveness tools, one from the COSI group and one from Aparian Global, that require self-assessments and give the students very granular advice and personal development plans to develop themselves more cross-culturally. And there's different outcome metrics we use. I'm not talking a lot today about assessment and evaluation, but CFHI participates in the Global Engagement Survey, and we do program evaluations as well. But I think sometimes it's the quotes that come from our scholars that are most impactful for me to hear. This is an example of one of our alumni from our program in the Philippines earlier this year, who said, "The program stretched my ability to approach global health work with humility, patience, and cultural awareness. Professionally, it reinforced systems thinking and the importance of understanding governance, resource allocation, and community trust when evaluating health interventions. Personally, the experience enhanced my adaptability and comfort working in unfamiliar, resource-constrained environments while maintaining professional boundaries and ethical standards." So when I hear these types of quotes, I feel a real sense of confidence that we're having the impacts we're hoping to have. We have extensive pre-departure training, which includes our 8-modular course, Pillars of Global Health, but also a strong focus on wellness and safety. I want to invite Bethany to speak a few minutes about our safety and security infrastructure.
Great. Thank you, Jess. So at CFHI, we see the pre-departure phase as a really key part of the process in ensuring that students have value alignment with CFHI, and see this as a way to prevent incidents once they arrive on site. We have learners who are, very strongly aligned with our approach, especially as we consider, putting them in settings that they're going to encounter a lot of difference. They're going to be in lower resourced settings. So our asynchronous modules, our live virtual orientation that we host with students really place a strong emphasis on our ethical framework and encourage students to approach those moments of conflict with curiosity, as we saw in those shifts that Dr. Everett was talking about earlier. We also have guiding principles for health and safety that really encourage students to recognize their own role in minimizing risk on the program, keeping themselves safe, keeping the patients around them safe, in alignment with our ethical framework. Just to give you a little peek behind the curtain, we are constantly evolving our pre-departure materials, and one of the things we have recently added is an entire module on collective safety and allyship. So again, encouraging students to recognize their own role in maintaining health and safety for the group while they're abroad. Also, just to shift to the on-site experience as well, of course, we have a really robust infrastructure that also responds to incidents once students arrive on site. This includes, of course, our local team on site, our medical director and local coordinator who are with students and available to them 24/7 while on the program. We have an established emergency procedures manual and strong communication matrices for communicating incidents to our academic partners when they occur. We also, of course, have a 24/7 dedicated emergency line that will go through to me at any time of the day. And we also enroll students in an insurance plan that will cover them for any medical needs that come up while they're abroad, emergency evacuation, reunion, and of course, political and natural disaster evacuation.
Thank you so much, Bethany. Bethany mentioned our Alumni Advisor Program. This has been developed over the last 3 years because there's a lot of benefit to students and trainees hearing from their peers and getting that perspective of someone who recently went to the same exact program site. So we have 18 alumni advisors, and they do pre-departure meetings with the trainees. They have weekly check-ins and post-program reflection. And so they're a really great complement to the programmatics that's being run by the faculty and local teams. Another mechanism of support is obviously financial support. So CFHI does have a tuition. It can range anywhere from $500 to $3,500 depending on the program. But we are very committed to keeping our programs accessible by diverse learners. And so we have committed a significant amount of scholarship money over our lifetime, and we will continue to increase that to the greatest extent possible. We have scholarships that have 3 due dates over each year. You can see here, some of them are more general scholarships. Some of them are for particular groups, such as fourth-year medical students or students from particular types of institutions, such as HBCUs and community colleges. And then some of them are geographically centered, such as our Friends of the Philippines scholarship. So we really encourage students to look at these opportunities. We also have scholarships for our virtual programs, as you can see here. When we look at the quotes from our scholars, they echo those that I already shared with you, but really just showing this transformative opportunity that wouldn't be available without the scholarship support. And just to point out too, that we do support and want to increasingly support South-South exchanges. And so CFHI is not just about sending high-income students to low middle income settings. And you can find out more about our scholarships on our website, of course. I want to discuss briefly a little bit of a flow chart for what it looks like to start a partnership with CFHI. There is no cost financially. It really just requires time and stakeholder engagement. So you can kind of see how it starts here. We start with exploratory conversations, and then making sure that we're engaging with the right units on campus or stakeholders within your department to explain who CFHI is and why it's a good fit for partnership. CFHI does not require one type of MOU or another. We do have partnerships that are based on handshake agreements because different institutions have different kind of legal preferences around this. And so we can use our MOU template, we can use your MOU template, we can have a handshake. Either way, there's usually some sort of iterative editorial cycle it require around a formal MOU if that's desired, and then formalizing that. Following that, we will help with info sessions and joint promotion of the opportunities you're offering students. And then there's an application and enrollment period, which can happen on your side or on our side or on both sides. We figure that out. And then CFHI will do pre-departure training, which can also complement pre-departure training that you're doing, of course, the in-country, and then the ongoing kind of check-ins and relationship maintenance. I want to invite Carolina Bolaños to speak a bit about CFHI custom programming and how that process takes place.
Thank you. And I'll start by saying that all processes for custom programs looks a little bit different. We do align with what the university requirements are in terms of curriculum, but also in terms of the admin or operations or how this comes together. So there's some custom programs that are built quite fast, others that take a few years to see actually implemented, and we really like to align with the model that works best for each institution. So CFHI custom programs are built upon the infrastructure that Dr. Ever was mentioning around CFHI long-term partnerships and the frameworks that represent that. So different than another type of a custom programs, it doesn't require the faculty or the administrator to come already with a set idea to what they want included in the program. Actually, we prefer when we have that initial conversation first to align on the basics, the values, the curriculum that we want to see built around for those students. So in this conversation, we try to bring together both the learning outcomes or objectives that was designed by the institution, if they already have a syllabus in place, or if this is just a first idea of a program, with the global health competencies that just mentioned, and also with the CFHI opportunities and the teams and the strengths of our teams on the ground. So which site would be the best fit, and within that site, which type of program, activities, workshops, site visits might fit best for that curriculum. So this is a very collaborative process that we engage with the faculty and the institutions to make sure that at the end of the day, under different iterations of schedules and program proposals, we get to a point where we both have the shared understanding of how the learning experience is going to look like for the students in country. And having said that, the role of the faculty, it is quite flexible, and we've been seeing this shift more and more throughout the years. Before, when we talk about custom programs, initially many institutions think about faculty-led programming, where you have the faculty leading sessions in country, seminars, and having a very heavy load in terms of the academics and teaching. However, that has transitioned quite a lot at what we have right now. So we have models where the faculty is leading reflection for the students in country and connecting the dots between the site visits and the maybe clinical rotations with other themes that they're seeing in their class. Or we have faculty that are leading some of the seminars in country, and even to the extent that we have faculty that are staying back home in the US and leading part of the conversations and reflection on a virtual space, because we do have the infrastructure and the team to lead those programs without having to rely too much on the faculty. So that part of the faculty engagement is also something that we discuss to customize to what it feels best for each institution. Then we, of course, can work through which the location it might be the best fit, the language requirement that we want for each student, if it's Latin America or outside of Latin America, the duration starting in 1 week, and or how many 8 weeks we want students to be part of this program, the disciplines that we want to engage, and if this is a multi-department program, we sometimes have that we're having enrollment from different departments within the same institution, or if it's only one, and of course the theme or the curriculum that we want to see represented in this experience. So these are just a few examples of programs that are running or planning to run in the short term. So one we have around holistic health, and this one looks more around the social understanding of what holistic health means. So not only looking from a clinical based medicine, but also outside support system, community health, and so on. We have a program looking at maternal health. We've had a program looking at public health in rural settings, food security, community nutrition, and the list goes on. Each program is unique, and that's the whole essence of how we customize programs. And again, I cannot stress enough the part of the collaborative process and collaborative model to get to our curriculum.
Thank you so much, Carolina. So if you want to discuss more, please reach out. Here's my email, and I can connect you with the right folks at CFHI or have exploratory conversations. Before we sign off, I wanted to see if there were any questions or comments from anyone.